Hey one and all, welcome to Dr. John's Amazing Videos channel. Did you know that heart failure affects millions of people worldwide? It's a serious condition, but early recognition and treatment can make a world of difference. We often associate heart problems with sharp, sudden pain, but the heart failure can be a lot more subtle. That's why it's crucial to be aware of the warning signs your body might be sending you. In today's video, we'll uncover the top 5 signs of heart failure that you absolutely shouldn't ignore. We're going to break down each symptom, explain why it happens, and what you should do if you experience it. Remember, this video is for informational purposes only and is not a substitute for professional medical advice. If you're experiencing any of these symptoms, please consult with a healthcare professional for personalized guidance. One of the most common and noticeable signs of heart failure is shortness of breath, also known as dyspnea. Now, we all get winded from time to time, especially after a good workout, but with heart failure, shortness of breath tends to be persistent and can even occur during everyday activities like walking up a flight of stairs or doing simple chores around the house. That's because when your heart isn't pumping efficiently, it can't circulate oxygen-rich blood throughout the body as effectively. Your body then tries to compensate by triggering rapid, shallow breaths, leaving you feeling breathless. So if you find yourself struggling to catch your breath more often than usual, even during light activities, it's crucial to pay attention and consult with your doctor. Moving on to our next sign, let's talk about persistent coughing or wheezing. This symptom can often be overlooked or mistaken for something less serious, like a common cold or seasonal allergies. However, it's crucial to understand the underlying causes and when to seek medical attention. Now, we all experience coughs and wheezes from time to time, especially during cold and flu season. These are usually temporary and resolve on their own with rest and over-the-counter medications. But what if the cough doesn't go away? What if it lingers for weeks or even months? But when it comes to heart failure, this coughing is often persistent and doesn't seem to go away. Unlike a typical cough that might improve with time, a heart failure-related cough can be relentless. It can disrupt your daily activities, making it difficult to focus on work or enjoy leisure time. You might also notice that it worsens when you lie down, similar to the shortness of breath we discussed earlier. This is because lying down can cause more fluid to accumulate in the lungs, exacerbating the cough and making it even more uncomfortable. This is because, as we mentioned, heart failure can cause fluid to build up in your lungs, a condition known as pulmonary edema. Pulmonary edema occurs when the heart is unable to pump blood efficiently, leading to a backup of fluid in the lungs. This fluid buildup can make it difficult to breathe and cause a persistent cough. Your body then tries to clear these fluids by coughing, which can lead to that persistent nagging cough. It's your body's way of trying to expel the excess fluid and keep the airways clear. However, this constant coughing can be exhausting and may interfere with your ability to get a good night's sleep. The wheezing sound, on the other hand, occurs when the airways in your lungs become narrowed due to fluid buildup, making it harder for air to pass through. Wheezing can be particularly distressing, as it often feels like you're struggling to catch your breath. This can lead to anxiety and a sense of panic, further complicating the situation. If you experience persistent coughing or wheezing, it's important to consult a healthcare professional. They can perform a thorough examination, including listening to your lungs with a stethoscope to determine the cause of your symptoms. Early diagnosis and treatment are key to managing heart failure and preventing complications. Diagnostic tests such as chest X-rays, echocardiograms, and blood tests can help identify the presence of fluid in the lungs and assess the overall function of your heart. These tests provide valuable information that can guide your treatment plan and help improve your quality of life. Treatment for heart failure-related coughing and wheezing may include medications to reduce fluid buildup, improve heart function, and alleviate symptoms. Lifestyle changes, such as reducing salt intake, maintaining a healthy weight, and engaging in regular physical activity, can also play a significant role in managing heart failure. Additionally, joining a support group or seeking counseling can provide emotional support and help you cope with the challenges of living with heart failure. Sharing your experiences with others who understand what you're going through can be incredibly comforting and empowering. Advances in technology have also made it easier to monitor your condition from home. Devices that track your heart rate, blood pressure, and other vital signs can help you and your healthcare team stay on top of your health and make timely adjustments to your treatment plan. Incorporating relaxation techniques such as deep breathing exercises and meditation can help reduce stress and improve your overall well-being. Managing stress is an important aspect of heart health as it can have a direct impact on your symptoms and quality of life. Remember, taking care of your heart involves a holistic approach. Eating a balanced diet rich in fruits, vegetables, whole grains, and lean proteins can support your heart health and help manage symptoms. Staying hydrated and avoiding excessive alcohol and caffeine intake are also important. Regular physical activity such as walking, swimming, or yoga can strengthen your heart and improve your overall fitness. It's important to find activities that you enjoy and can incorporate into your daily routine. Always consult your healthcare provider before starting any new exercise program. Living with heart failure can be challenging, but with the right support and management strategies, you can lead a fulfilling and active life. Stay informed, stay proactive, and don't hesitate to reach out for help when you need it. Your health and well-being are worth the effort. Thank you for watching. Remember, recognizing the signs and symptoms of heart failure early can make a significant difference in your health outcomes. Stay tuned for more information on managing heart failure and living a heart-healthy life. All right, let's talk about another sign of heart failure that you absolutely shouldn't ignore: swelling in your legs, ankles, or feet. This is a symptom that can often be overlooked or mistaken for something less serious, but it can be a crucial indicator of your heart's health. Swelling, also known as edema, can be a sign that your heart isn't functioning as well as it should be. You might hear doctors call this edema, but don't let the fancy medical term throw you off. Edema simply means swelling caused by excess fluid trapped in your body's tissues. It's a common issue, but when it becomes persistent or severe, it can be a sign of underlying health problems, including heart failure. It's something you can easily check for at home. All you need to do is take a few moments to observe your legs, ankles, and feet. Look for any unusual puffiness or swelling. You can also gently press your finger into the swollen area to see if it leaves an indentation. This is a simple yet effective way to monitor your health. Now, I'm not talking about a little bit of puffiness after a long day on your feet. We've all been there. It's normal for your feet and ankles to swell a bit after standing or walking for extended periods. This kind of swelling usually goes away after you rest and elevate your legs. However, if the swelling persists or worsens, it could be a sign of something more serious. I'm talking about persistent swelling, especially if it's getting worse over time. This kind of swelling doesn't go away with rest and can be a sign that your heart is struggling to pump blood effectively. When your heart isn't working properly, fluid can build up in your lower extremities, leading to chronic swelling. If you press your finger into the swollen area and it leaves a dent, that's called pitting edema, and it's a key sign that something might be off. Pitting edema occurs when fluid accumulates in the tissues and doesn't return to the bloodstream as it should. This can be a sign of heart failure, kidney problems, or other serious health issues. So, why does this happen? Why does your body start to swell when your heart isn't working properly? The answer lies in the way your heart and circulatory system function. Your heart is responsible for pumping blood throughout your body, delivering oxygen and nutrients to your tissues and organs. Well, when your heart isn't pumping efficiently, it can cause a backup of fluid in your body. This is because your heart isn't able to move blood through your circulatory system as effectively as it should. As a result, fluid can start to accumulate in your tissues, leading to swelling. Think of it like a traffic jam in your circulatory system. When there's a blockage or slowdown in traffic, cars start to back up. Similarly, when your heart isn't pumping efficiently, blood and fluid can start to back up in your body. This can lead to swelling in your legs, ankles, and feet, as well as other symptoms like shortness of breath and fatigue. This fluid often accumulates in your lower extremities because of gravity, leading to that uncomfortable swelling. When you're standing or sitting for long periods, gravity pulls fluid down into your legs and feet. This is why you might notice more swelling at the end of the day or after you've been on your feet for a while. Now, keep in mind that swelling in your legs, ankles, or feet can be caused by other things besides heart failure, like standing for long periods or even certain medications. Some medications, such as those for high blood pressure or diabetes, can cause fluid retention and swelling as a side effect. It's important to talk to your doctor if you notice any new or worsening swelling, especially if you're taking medication. But if you notice this symptom, especially if it's accompanied by any of the other signs we've talked about, don't hesitate to schedule a visit with your doctor. Early detection and treatment of heart failure can make a big difference in your quality of life and overall health. Your doctor can help determine the cause of your swelling and recommend appropriate treatment options. So keep an eye on your legs, ankles and feet, and don't ignore any persistent or worsening swelling. Your heart health is too important to overlook. All right, let's talk about fatigue and weakness. These are feelings that can affect anyone at any time, but they can be particularly concerning when they become a constant part of your daily life. We've all experienced feeling tired after a long day, right? Maybe you've had a tough day at work, or perhaps you've been running errands non-stop. This kind of tiredness is usually temporary and can be remedied with a good night's sleep or a relaxing weekend. But when you're experiencing fatigue related to heart failure, it's different. This isn't the kind of tiredness that goes away after a few hours of rest. It's a deep, persistent exhaustion that doesn't seem to improve no matter how much you sleep or rest. This kind of fatigue is persistent. It lingers and affects your ability to function normally. You might wake up feeling just as tired as you did before you went to bed, and this can be incredibly frustrating and debilitating. It's not just about needing an extra cup of coffee, it's about feeling drained even after a full night's sleep. Imagine waking up in the morning expecting to feel refreshed, but instead you feel like you haven't slept at all. This is a common experience for those dealing with heart-related fatigue. You might find yourself struggling to complete everyday tasks that used to be easy. Simple things like doing the laundry, cooking a meal, or even taking a shower can feel like monumental challenges. This can lead to a sense of helplessness and frustration. Simple activities like walking up a flight of stairs or carrying groceries can become incredibly taxing. You might find yourself out of breath, needing to take frequent breaks, or even avoiding these activities altogether because they feel too overwhelming. This is because your heart, the engine of your body, isn't pumping blood efficiently enough to deliver oxygen and nutrients to your muscles and organs. When your heart can't keep up with the demands of your body, your muscles and organs don't get the energy they need to function properly, leading to that persistent feeling of fatigue. If you're constantly feeling wiped out and this fatigue is coupled with other symptoms we've talked about like shortness of breath or swelling, it's crucial to pay attention. These symptoms together can be a sign that your heart is struggling and needs medical attention. Your body might be trying to tell you something's up. It's important to listen to these signals and not dismiss them as just being tired or overworked. If you notice these symptoms persisting, it's time to consult with a healthcare professional. They can help determine if your fatigue is related to heart failure or another underlying condition and provide the appropriate treatment to help you feel better. Remember, your health is paramount. Don't ignore persistent fatigue and other related symptoms. Early detection and treatment can make a significant difference in managing heart failure and improving your quality of life. So take that step, talk to your doctor and take control of your health. With the right care and attention, you can manage your symptoms and lead a fulfilling life. Don't let fatigue hold you back. Listen to your body, seek help when needed, and take proactive steps towards better health. You deserve to feel your best every day. Now, let's tune into the rhythm of your heart. Literally, your heart should beat in a steady, rhythmic pattern, like a drummer keeping the beat for a song. But with heart failure, that rhythm can get disrupted. You might feel like your heart is racing, fluttering, or skipping a beat. This is often described as a rapid or irregular heartbeat, also known as palpitations. Why does this happen? Well, when your heart is weakened, it has to work harder to pump blood effectively. Think of it like a car engine struggling to climb a steep hill. It has to rev higher and work overtime. This extra effort can lead to a faster heart rate and an irregular rhythm. While occasional palpitations are common and usually harmless, persistent or concerning palpitation should never be ignored. We've covered a lot today, from shortness of breath and persistent coughing to swelling, fatigue, and irregular heartbeats. These are just some of the potential warning signs of heart failure. If you or someone you know is experiencing any of these symptoms, don't wait. Seek medical advice immediately. Early detection can make all the difference. And don't forget to like, share, and subscribe for more health tips and information. Remember, early detection can make all the difference. Stay informed, stay healthy.